Good morning, and thank you for attending. Today, I'm joined by Dr. Carol Zimbalati, public health physician, to give an update on our local COVID-19 situation, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, who will provide an update on the COVID-19 vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in this region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. The COVID-19 situation is changing at an alarming rate. Urgent action is needed now. I recognize we're all tired and frustrated and we just want COVID-19 to disappear, but unfortunately that's not a reality. We are once again at a pivotal point in the pandemic and experiencing a rapidly changing situation, and our efforts must continue. In a short time, Omicron has become the dominant variant of COVID-19 within Ontario and is expected to make up close to 100% of the cases by the end of December. Provincial case rates continue to rise and are at approximately 56 per 100,000. The number of positive test results have almost doubled in only a week, from 3.5% to 6.6%. Omicron is almost 8 times more infectious than the Delta variant. It is expected that the healthcare system will be in jeopardy with the increase in Omicron cases across the province, even if Omicron does prove to cause more mild disease than Delta. There is still very limited evidence on the severity of illness that the Omicron variant could cause in our communities. As a result, Ontario has put in testing protocols and other public health measures for long-term care homes and retirement homes. There is now 50% capacity restrictions for indoor arenas and venues, with the usual capacity greater than 1,000 people. But there is still more you can do. Although 2 doses of COVID vaccine are less effective in preventing Omicron infection, they are showing good results in protecting against severe illness. The protection against severe illness is much stronger with a 3rd dose, and research is indicating that 3 doses of vaccine could be as effective against Omicron as 2 doses are against other COVID-19 strains. Protecting against severe illness is important, as this is how we keep our healthcare system stable. So please, get your 3rd dose if you're eligible. With the holiday season in full swing, it is important that you consider the risk of your holiday plans. By limiting the number of social contacts you have, it will help to prevent spread within our community. Low community spread helps protect our kids who are not fully vaccinated and keeps them well and in school. And as always, if you feel sick, even if your symptoms are mild, please stay home and arrange to be tested for COVID-19. These aren't new measures. We have done this for the last 2 years and have been successful slowing the spread of the virus. You know what to do. So with that, I'll pass it over to Dr. Zimbalati.
Thank you, Dr. Chirico, and welcome everyone. In the last 7 days, we had 32 new cases, bringing our total case count to 988, with 693 in the Nipissing District and 295 in the District of Parry Sound. The health unit currently has 45 active cases. Currently, there is 1 individual in hospital due to COVID-19. This week, a number of individuals have tested positive for COVID-19 in connection with an out-of-district Omicron outbreak. Omicron is here in our community. Dr. Chirico spoke about how transmissible the variant is. It is imperative that we act now to prevent a surge in cases and an increase in hospitalizations and ICU admissions. We are at a point where making smart decisions, such as being fully vaccinated and receiving your 3rd dose, especially if you are at higher risk of severe illness or transmitting infection, These decisions may help slow the spread in our community. Also, consider adjusting your holiday plans given the increased transmissibility of Omicron and decrease your close contacts. Now back to you, Dr. Chirico.
Thanks, Dr. Zimbalati. And now I'll pass it over to Ms. Mantha to give us an update on our vaccine rollout.
Thanks, Dr. Chirico, and good morning, everybody. So as of yesterday at 3 p.m., 2,289 5 to 11-year-olds have received their first dose of the COVID-19 vaccine. This represents about 27% of 5 to 11-year-olds in our health unit district, compared to the province, who is at 32% of 5 to 11-year-olds who have received their first dose. On Monday this week, individuals 50 plus were able to book and receive a third dose of COVID-19 vaccine. As well, as of Monday, December the 20th, anyone 18 years of age and older will be eligible to book their third dose appointment. The required interval between the second and third dose for 18 plus has decreased to 84 days, presenting an opportunity to receive your third dose before Christmas holidays. Due to the emerging situation with the Omicron variant, we added just over 14,000 appointments over the next 2 weeks, and they are filling up very quickly. We will continue to add appointments as feasible and add appointment availability as needed to match demand. As well, we continue to explore alternatives to traditional vaccination clinics for delivering doses to everyone who's eligible. Our COVID-19 call center will be open this weekend from 10 a.m. until 3 p.m. We do prefer individuals make an appointment, as we are experiencing very large volumes of walk-ins right now. With these large volumes of walk-ins, it is challenging at times to maintain important public health measures like physical distancing, and individuals who walk in should be prepared to wait for their appointment. As Dr. Chirico and Dr. Zimbalati mentioned earlier, having your third dose is the best protection against severe illness from the Omicron variant. If you are unable to book an appointment at the health unit, we highly encourage you to get it at a participating pharmacy across our district. And lastly, our COVID-19 vaccine clinics are running regardless of weather, unless we post otherwise on our website. Thank you, and back to you, Dr. Chirico.
Thank you, Ms. Mantha. So that ends our remarks, and we'll turn it back over to Alex for any questions that you have. You can put them in the chat box left of your screen, and please associate your name with them, if possible. Thank you.
Thank you. So our first question is for Dr. Chirico. It comes from Brad at My North Bay Now. Dr. Chirico, Muskoka's Medical Officer of Health, Dr. Charles Gardner, said yesterday that he has a letter and a Section 22 ready to be issued to Muskoka residents regarding capacity limit restrictions if the province doesn't issue their own Ontario-wide restrictions to help tame the rise of COVID-19 cases. Are you prepared to do the same?
Well, thank you, Brad, for that question. Very important. And we all have to adjust to our local situations, as Dr. Gardner is. And I feel strongly that provincially mandated measures are really more effective than locally implemented measures when it comes to decreasing the rate of transmission. However, we all have to be very vigilant locally, and we need to continue to monitor our situation based on what the epidemiology is showing us. And we really locally need to adapt and make decisions accordingly. The province is likely to come out with some more announcements regarding public health restrictions tomorrow, and we'll have to see what they are. And if we feel that we need to, as Dr. Gardner has indicated, we need to enhance those, we certainly will. So answer to your question is yes, we are certainly considering that, depending on what the government will be announcing shortly. We may even have to look at all possibilities, and especially, the step 3 capacity limits, as other Northern Ontario health units have done in the recent past because of increasing cases. But having said that, I still think that we all have to take some responsibility for what's coming, and to be able to all work together and take some individual responsibility with our own actions. And I include all of us in saying that. that we have to limit our social interactions. We have to reduce the number of interactions, because that's the only way that we can help reduce the spread. This variant is highly contagious, and we do need to use really good judgment when we make decisions. So look at your risk, look at where you're going, look at who's going to be there. Are they vaccinated? Are they unvaccinated? Keep adhering to the public health measures and really use good judgment. That's the only way we can keep our healthcare system stable. So, you know, it's a lot of the same messaging that we've had before, and that is get vaccinated, limit, you know, your social contacts, use the masks appropriately, physically distance 2 meters, washing your hands. All of those things are really important, as well as if you have symptoms, even if they're mild, please stay home, isolate, arrange to be tested.
Thank you. Our next question is also for you, Dr. Chirko. It comes from Jamie from CTV News. Yesterday, Justin Trudeau advised that Canadians do not travel internationally for the Christmas holidays. Dr. Chirko, what is your message for people in North Bay who want to head south for the holidays?
You know, that's a good question. I think that you really have to do an individual risk assessment and figure out, you know, your own risks, where you're going. And personally, I would not be traveling internationally myself, and I would recommend that you don't do it. The Omicron is really different than what we've faced before. It is so much more contagious, and you have to consider you're going to be on a plane, you're going to be in a closed space. There are higher risks, and if you are at a person that is at higher risk, then you really need to consider that. So I'm not in favor of international travel.
Thank you. Our next question is for Dr. Zimbalati. There are 2 questions that are similar. The first is from Sarah Bissonette, and the second is from PJ. So are LCBO sites in Parry Sound or in Almaguin area going to have rapid testing available? And then also, will they be available in our area at all?
My understanding of the strategy for rapid antigen testing, the holiday pop-up strategy that the province has announced, is that that is for high prevalence areas. And so to our awareness, we have not been contacted by the ministry to host such pop-up clinics. So no, I do not believe that the LCBOs in our area nor other high traffic areas identified will be, I don't think those types of venues in our district will have the rapid antigen testing.
Thank you. Our next question is also for you, Dr. Zimbalati. It comes from PJ. Have there been any confirmed cases of Omicron variant locally?
No, we don't have any confirmed cases at this point. We are managing several cases that are associated with an out-of-district Omicron outbreak. So though we can't definitively say that, yes, it is in our district, given the prevalence in the province and the types of cases we are managing, it's almost guaranteed that it is in the area.
Thank you. Our next question is also for you, Dr. Zimbalati. There's 2 questions that are similar. So the first one is from Jamie from CTV News. Some school boards across the province have decided to start the new school year with remote learning. Is this a potential option in this region? And then from Sarah Bissonette from the North Star, does the health unit support temporary at-home learning following the Christmas break?
Yeah, that's an important question, and we've always said right from the beginning of the pandemic that in-person learning is crucial for the mental, social, and physical well-being of our children, and that is still our stance right now. I do not believe that the Ministry of Education has provided any direction to our local school boards that they should be transitioning to virtual learning after the holiday break, and we have not directed school boards to be switching to that to virtual learning either, because we do believe that schools should be the last to close and the first to reopen.
I'd also like to add too that what Dr. Zumwalt said is so important, and that we want to keep the kids in school, and we all play a role in helping that to continue to happen. So if people do adhere to limiting their social contacts over the holidays, and to try to reduce the spread, that the lower the community spread, more protective it'll be for the children, as well as being able to keep sort of cases low and keep them in school. So we will continue to monitor the situation very closely over the next few weeks, and then work closely with the school boards in any decision making that occurs.
Thank you. Our next question is for Shannon. It comes from Rich Coffin at mynorthbaynow.com. If the 1,400 new vaccine appointments are already filling up, is there concern about a massive backlog once third dose appointments are open to the 18+ on Monday?
Yeah, thanks for that important question. So yesterday with the provincial announcement, we learned about it almost at about the same time that the public did. So we had already ramped up adding those 14,000 appointments to ensure that we had enough access to vaccine appointments across the district. And we weren't anticipating the 18+ announcement until shortly after the new year. So with the added appointments or added eligibility groups, we are working furiously to add capacity to the system. We're working very broadly with healthcare partners across the district, primary care, acute care, as well as pharmacies, because public health is not the only channel to receive your vaccine. You can receive it at a pharmacy as well as primary care providers who are offering it. So I guess in closing, just to say we're working very hard to ensure everybody who's eligible for a third dose can get their third dose, as well as continuing with the 5 to 11 vaccines and individuals who want first and second doses. So lots on the table, lots ahead of us, and we're up for the challenge, and we're working together as a community.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Bissonette. How does where we are now compared to spring 2020? It feels similar with the fast pace of change and concerns for the healthcare system.
Yeah, thank you, Sarah. That's an excellent question, and there certainly does seem to be that similarity. What we have learned throughout the entire pandemic is that things can change quickly from one day to the next, and that's exactly what we're seeing. We're seeing a new variant, which is much more contagious. We're seeing that we have to adapt based on what the evidence is showing us. So we do know that the vaccines can really help prevent serious disease. And so again, we're having to adjust to get as many people vaccinated as quickly as possible, and especially in the highest risk groups. And that's exactly what we've done. I think the biggest difference from back then is that now we have been able to target those high risk congregate settings, meaning, long-term care homes, retirement homes, others where we have individuals that are at high risk, and we've gotten them vaccinated and we've gotten third doses into them. So we've really been able to move along and really increase the protection that we can for these vulnerable groups. And we saw that it worked with our outbreaks recently in long-term care homes, and how it prevented them from becoming ill, and none were admitted to hospital because of the COVID-19. So it really does work. So we have that real advantage that's different from the spring. We've got so many more people vaccinated. So yeah, we still have a ways to go, but the community support and the people that have reached out to the health unit, so many, and we are just so grateful. And as a community, we're going to get through this because of all the help and the work that everybody comes together to do this. So we will get through it. We will get to the other side, and we just need to continue to be vigilant at this time.
Thank you. Our next question is for Shannon. It comes from PJ. Do we have any figures for pharmacy doses?
Yeah, thanks, PJ. So we don't collect information from pharmacies. The Ministry of Health does collect that information and report on it from time to time. So I don't have any figures to report to you today. That's information that we perhaps could get for you, but there is a bit of a lag time as well with the pharmacy reporting. So don't have that data right now.
Yeah, we could be happy to look it up and see what we can find for you, PJ. But I just want to give a huge shout out to the pharmacies. Right from, I mean, even when we started with influenza vaccines, they were first to jump on board to help us out. They were so enthusiastic. They did a tremendous job to just with the influenza vaccines to increase accessibility to the vaccine. They've done exactly the same thing with COVID-19 and right from the beginning. And we're so grateful to all the pharmacies for their involvement and what they've done to help and will continue to do. So thank you so much for all your efforts and what you've accomplished.
Thank you. So that completes all of the submitted questions for today. So that will complete today's press conference. We will see you next week on December 23rd.